ProPublica investigated our situation with pharmaceutical prices in the U.S., and look at what they found. Our system is so screwed up and ass backwards that this happens. When buying prescription drugs, some pay more with insurance than without it. What? So they say a host of players, drug companies, pharmacies, insurers, and pharmacy benefit managers are taking a cut of the profits even as consumers are left to fend for themselves. Although there are no nationwide figures to track how often consumers could have gotten a better deal on their own, one industry expert estimated that up to 10% of drug transactions involve such situations. If true nationwide, that figure could total as many as 400 million prescriptions each year. Wow. Think about that. So you have insurance, you're covered, but you're going to pay more for your drugs in 10% of the time, or roughly 10% of the time. The whole system is broken and corrupt and rigged. Okay, now, look at what it's like in the UK. Cost of prescriptions hit £8.60. Is that how you say that? I think that's how you say that. In April. 8 ways you can beat it. GP prescriptions and dental charges are to change in October under new rules in line with inflation, but you don't have to stand for it. I love that. They're like, you know, hey, it's about $10 basically to get a prescription, but you don't have to stand for this tyranny. Tyranny. That's a fucking paradise compared to the U.S. Look at the U.S. $1,000 pill for hepatitis C spurs debate over drug prices. Really? You don't say. People weren't able to just pay for a fucking $1,000 hepatitis C treatment? Can you imagine being sick with something that you need treatment for, and they're like, anyway, that's nice, $1,000. That's tyrannical. That's tyrannical. Oh, your poverty is preventing you from being fucking treated for an illness. That sucks. Meanwhile, in the UK, they're like, everything is about $10. It doesn't matter how sick you are. It doesn't matter if the production of your medicine costs $17,000. It doesn't matter. Doesn't matter. This is why we have taxes. This is why we have a civilized society. You pay taxes, you get help when it comes to healthcare. So we've decided that's the case because we're not idiots. So, okay, here, you pay about $10 and you get your treatment, even if the treatment costs fucking $170,000 to make. Here in the U.S., the fucking pill that treats hepatitis C, maybe that thing only costs $300 to make. But they're like, I don't know, we could charge $1,000 and rip them off, so fuck it, let's rip them off. And then when Bernie Sanders steps up and says, hey, I got an idea. How about we re-import drugs from Canada so that we pay significantly cheaper for the same drugs? Right now we're paying 3 times more in some instances than Canadians. Why not re-import the drugs, have the cheaper price, and this way people can get the medicine they need and not go broke? And there were many people who were like, Bernie Sanders looking out for the people. Anyway, where's my big pharma check? No, Bernie, we're not in favor of that. It's disgusting. Our system is broken, and we need to fix it. And the answer is Medicare for all, and the answer is price controls for pharmaceuticals.